That's why. All right, so we're gonna go ahead and get started. So first off, thank you guys for coming here tonight. It's gonna be good to spend the night with you. We should be about 45 minutes to an hour or so, kind of see how it goes, and feel free to ask questions and be interactive. So tonight's topic is neck pain, and we're just gonna kind of dive right into it. Neck pain is one of those things that's probably one of our top conditions that we see from patients. So it's one that's important to everybody. So if you've got neck pain, or someone that you know or you love is dealing with either the pain or the inflammation or the swelling or arthritis in the neck, that kind of stuff, you're in the right room tonight, okay? So we're just gonna jump right into it here. So how many of you guys have a cell phone? Raise your hand. How many of you, like everybody in your family has a cell phone? Raise your other hand. And then if you think you spend too much time on your cell phones, wave your hands around.
Yeah.
Right? So we probably all innately know that we're spending too much time on our phones and our screens and devices and looking down. And I think you guys would probably agree with me that innately we know and we can feel that probably we shouldn't be doing that, right? Like it's having some effects on our body. So, this neck pain and the problem with like looking down at screens and cell phones and tablets and all that kind of stuff has led really to like almost a pandemic of neck pain, right? We see this has been growing and growing since cell phones and things like that have become more and more common. And the health experts have actually kind of dubbed this nickname to it called tech neck. So, you guys have probably heard the term that sitting is the new smoking. So if sitting is the new smoking, screens are kind of like the new crack. They do even more damage to the body than sitting at the computer all day long. So when we look at things like tech neck, you'll see that it can lead to issues like the chronic neck pain. It can lead to nerve problems for the nerves that come out of the spine and the neck area. And those nerve problems can travel all the way down into the arms. So even upper extremity issues, pain in the arms. And it can even lead to herniated and bulging disc, which is a huge complication that can create a lot more problems with this. When we are constantly looking down at screens, or we're reading, or we're on the computer and our ergonomics are wrong, and we're working from a laptop and the head is going down and forward, it puts the neck into this position of flexion. And the natural position for the neck is extension, and the head should be balanced over the torso. So when we have flexion of the neck, that can cause issues like neck pain. It can lead to instability issues where the neck is not stable because the ligaments are getting too stretched out or overstretched. It can cause things like stiffness and tightness because the muscles are innately trying to protect that. So then the muscles start grabbing and getting tight. It can lead to problems with balance because if our head goes too far forward, we don't want to fall forward. So usually the rib cage is going to go back. So the pelvis comes forward, and we have all these compensations that start happening. It can obviously affect range of motion, and a big issue for range of motion for a lot of people is when they're driving, because when they're either merging into lanes, to look to see who's on the side of them, or they're backing out of a parking spot and they can't turn their neck right. So it leads to issues with that. Trigger points are like these points in our muscles where we just get like these little kind of tight spasm little points in the muscles that create pain. Fibromyalgia is a condition where we can end up having pain kind of all like almost unexplained pain like all over the body. The people are very sensitive to it, sometimes even just sensitive to like a light touch can create a lot of pain. Obviously degeneration in the disc and the joints of the cervical spine, that can lead to arthritis. Like I was saying, disc bulges and herniations. I'll show you what that looks like here in a minute. Upper extremity issues too. So, again, numbness and tingling going down into the arms. Sometimes carpal tunnel syndrome, where people get, numbness and tingling in the hands, weakness in the wrist, all that kind of stuff. A lot of times can come all the way from up here in the neck because the nerves that come out of the lower part of the neck go down the arms all the way into the hands. And then even mid-back and low back pain, because when the spine is imbalanced, a lot of times we will have compensations, right? Like I was saying, if the head's going forward, part of us is going to go back, and it can lead to issues in the low back. When we look at the spine from the side, you'll see that there are three curves. There's a back to front curve in the neck and the low back, and there's a front to back curve in the mid back. And those three curves almost work like gears. So if we start to turn the one gear, like in the neck, and straighten out that curve, it can start to affect the other gears or the curves in the mid back or the low back. It can cause headaches, it can cause dizziness, it can cause all types of issues. But the real problem is not just the symptoms, it's what we like to call the life effect, right? So how is this stuff affecting your life? When people are having neck issues, a lot of times we'll see that they may have issues with personal care, so anything like washing the hair, for example, bending over to tie your shoes, just looking down, or painting your toenails, or whatever it is. Lifting, a lot of times, people have little kids and, they want to lift their kid and hold their kid, or sometimes people have jobs where they have to bend over and lift. If we have a desk job or something like that, an office job, even concentrating, right? Because when we are in pain, it's hard to keep your focus and it's hard to have good concentration. It can obviously affect travel, it can affect sleep. And if we've got bad sleep, then we're tired, right? And then that goes down and starts affecting our productivity. It can cause us to start skipping out on things that we really enjoy doing, like exercise, which for a lot of people is like actually a stress relief. But if we're in pain and we can't exercise, then we can't get that stress relief, then we're overstressed, and then we'll talk about what that does to the body too. But the big thing for me is mood, because I see people who come in and they talk about, they've got neck pain or they've got low back pain. And when I start to ask them, how it affects them and does it affect their mood, a lot of times people will tell me, yeah, it makes them crabby. And then so they've had a long day at work, they're not feeling good, they're tired, they're unproductive, and they go home, they're in a bad mood, they're kind of short with their spouse or short with their kids, and then it even starts to affect things like relationships, so it can have a lot of effects that go into different areas of our life. So what we know is that neck pain is a symptom, right? So a symptom is actually, we want to make sure that we understand what a symptom is. A symptom is like a body signal, right? It is a signal from your body telling you that something is wrong, So when we have a symptom, it's not normal, right, to have symptoms. When we have them, it's actually a good thing. It's serving a purpose. A symptom's kind of like when the check engine soon light comes on the dashboard of your car. It's there to tell you that something's wrong, right? So we need to know that. It's like the smoke alarm going off, like if there's a fire in your house and you're not aware of it right away, you're wanting to make sure that smoke alarm is going off to tell you. So body signals are smart, right? Because is your body smart or stupid?
Smart.
It's smart, right? It is incredibly smart, but we have to learn to listen to it, and we have to learn to understand it. So you got to know that a symptom is a good thing, but a symptom is kind of like, it's like the tip of the iceberg, right? Because a lot of times when we look at health conditions that we have, usually they're not symptoms, right? You guys know what the number one disease killer in the country is right now? It's heart disease. You know what they call heart disease, the nickname for it? They call it the silent killer. You know why?
Oh, yeah.
Why would they call it the silent killer?
No symptoms.
Yeah, a lot of times there's no symptoms, right? People might feel totally fine one day, and then all of a sudden, middle of the night, wake up and have a heart attack, right? Because there's a lot of times there's not really symptoms of it. So if we're getting symptoms, that's a good thing. But we got to understand that usually there's a bigger problem underneath the surface. So make sure that you're paying attention to your body. At first, when there's something going wrong, your body's gonna whisper to you, right? You're gonna notice it. There's gonna be something a little off or a little weak or something that doesn't feel so good. But if you ignore it, the body's gonna start screaming at you, right? And then you're gonna really be in pain, and you're not gonna like those symptoms. So when you have symptoms, you've got a couple choices, right? First off, a lot of times people will just kind of ignore it. Right? They'll think, well, maybe it'll go away, it'll get better in a day or two or something like that. Or sometimes people will say, well, I'm just getting older, it's part of old age, it's aches and pains, growing pains, that type of thing. But we don't want to ignore it, because if we ignore the symptom, the problem's just going to get bigger, right? It's like if we ignore the check engine soon light in the car and something's wrong with your engine, you're going to have a breakdown at some point, right? So we can also, a lot of times what people will do is they'll try to turn the symptom off, right? So they will take medication, which is, in my opinion, even more dangerous than ignoring the symptoms, because now you're putting chemicals into your body that's altering your body's natural physiology, right? And it's shutting off that symptom. And what I see is a lot of times when that symptom gets shut off before the problem is addressed, is people will keep on doing the same things that caused the problem in the first place, and the problem just gets bigger and bigger and bigger. Or sometimes people, let's say like a muscle relaxer. Let's say you injure your back and you take a muscle relaxer and you're like, oh yeah, I feel better. but your body hasn't healed yet. And then you go to the gym and you start lifting some weights because you feel better, or you go out in the garden and you start pulling some weeds because you feel better, and then it gets just flared up even that much more, right? So we don't want to ignore it. You know, taking a medication is like putting a piece of duct tape over the check engine soon light in the car. It doesn't really fix the problem. It might stop it from being annoying for a minute, but you know, if we just cover up this, and this whole thing is the problem, but we just cover up that part with medication, is that gonna fix us or make us healthier? No, right? So symptoms are a good thing. So we gotta make sure that we're listening. But you also gotta understand that symptoms aren't the end all be all, because again, we can have heart disease and not feel it, right? Can you have cancer and not feel it?
Yeah, sure.
Yeah, absolutely, right? People get diagnosed with cancer when they're stage 3 or stage 4, and a lot of times it's being missed in stage 1 and stage 2 because there's no symptoms, right? So we have this thing that we call like the illness wellness continuum, and the thing is that we all fall somewhere on this scale, right? So on the far right, we have this high level wellness. Things are functioning, things are good, you know, they're healing, we're strong, we're a lot of times getting stronger, getting healthier, that type of thing. And on the other end, on the far end, we've got like premature death, right? So again, we're all gonna fall somewhere on this paradigm. Now, the neutral point you'll see is that there's no discernible illness or wellness, right? So we don't necessarily feel or have, you know, signs or symptoms of it one way or the other, right? So just because we're neutral doesn't mean actually that we're healthy, right? Just because you don't feel a blocked artery, or just because you don't feel a tumor that's grown in your body doesn't mean that you're healthy, right? So there's this neutral point, right? Now, if we take just one step to the left here, the first thing that you're gonna see is signs. You guys have heard of signs and symptoms. Who knows what the difference is between a sign and a symptom?
I don't know.
Any ideas? So I'll tell you, the signs are gonna be more objective, right? So signs are things that we might not necessarily feel, but let's say we go and we get a physical and we get some blood work done, and then the doctor comes back and says, Steve, your cholesterol is too high and your blood sugar is too high, but you didn't feel that, right? But we now have some objective evidence. So that's what we would call a sign. A lot of times, like poor posture can be a sign too. Like we might not necessarily feel it, but somebody else can look at us and say, oh man, did you know your head's hanging out over here to the side like that? You know, or we see that kind of thing. If it's left untreated, right, if we aren't taking care of the things that are causing the signs, then the signs will turn into symptoms, right? Then the body's gonna start speaking to us, it's gonna start whispering to us. And the difference is that with symptoms, we can feel it, right? So again, the body's giving us some type of signal. If we were to ignore the symptoms, right, and we keep doing the same things that are causing damage that cause the signs and the symptoms in the first place, the problem again is just gonna grow like a bigger and bigger iceberg, right? And eventually it's gonna lead to conditions or some type of disability. We can't do the things that we wanna do. We can't pick up our kid anymore. We can't run or go for a long walk to relieve that stress anymore. We've got some sort of disability because we're not taking care of it. So understand this, that you know, everybody is gonna fall somewhere on here. And the other thing is that we are not static, right? Our bodies and our lives are dynamic. They're ever changing, right? You guys have heard of homeostasis, you know, from back in high school biology and stuff. So everything's always changing and adapting to the situation. So it's not only where are you on here, but it's also what direction are you moving? Are you moving in this direction? Or are you moving in that direction? And not only that, but also how fast are you going there, right? Because if you're sitting around smoking a pack of cigarettes and, you know, drinking a 12-pack of beer and eating cheeseburgers and French fries every night, you're probably going in this direction pretty quick, right? But on the flip side, we can do things about it. So one of the first things is awareness, right? We want to learn to become aware of what's going on in our body. Education is huge, right? But here's the thing that I know is that, you know, after probably 13 years of doing this and treating patients, is that education is huge and knowledge is huge, but it doesn't really mean anything without action, right? We can have the knowledge, but if we don't make a decision to start having a different lifestyle or taking different actions, it's still not going to change anything, is it? So you know, what we see a lot of times is that people who are taking action and they're committed to taking action, they get really good changes, right? The people who are not taking action or they're taking kind of slow baby steps, they don't get as good of changes. And the other thing that I can tell you after 13 years in healthcare is that healthcare is not a done for you process, right? It is a done with you process. So you have to play an active role because your doctor's not responsible for your health. You know, your insurance company isn't, the pharmaceutical company isn't, the government isn't. You know, if you've got Medicare or something like that, there's only one person who's truly responsible for your health, and who is that? It's you, right? So, you know, unfortunately, we are taught, when we think about healthcare, we are taught to base our health off of how we feel, right? We think, most Americans think, hey, if I feel good, then I'm healthy, right? If I feel bad, then I'm sick, right? But again, look at heart disease, look at cancer, look at diabetes, look at high cholesterol, high blood pressure, all these things that we don't feel, right? And there's a really good reason why we don't feel a lot of that stuff. When we look at the nervous system is a system, it's like the master computer control system for the whole body. And if we break down that central nervous system, it's broken down into 3 parts that are called the motor nerves, the sensory nerves, and the autonomic nerves. Now, the motor nerves are the signals that are going from the brain down the spinal cord and across the nerves that are going to your muscles and your muscles so that you can move, right? You can pick things up, you can bend over, you can twist, you can look behind you when you back your car out of the driveway, all that type of stuff. So that's motor nerves. Motor nerves make up about 45% of the nerves in the body, so it's a good chunk, right? Another one is what we call autonomic nerves. So that word autonomic kind of sounds like automatic a little bit, right? So think about all of the things that happen automatically in your body without you having to make a conscious decision, like pick up this ball, right? Your heart beating, your lungs breathing, digestion, respiration, blinking your eyes, healing, reproduction. You know, I had a patient earlier tonight who just told me she was pregnant, and we were just talking about how amazing is that, you know, that you are growing a human being in your belly and you don't even have to do anything, right? Like this innate wisdom, this power that God put in us is just doing it all for you. So that type of stuff is happening under control of the autonomic nervous system. That's also about 45% of the nerves in the body, right? So that means that this sensory system, which controls things like pain, right? Pain or temperature or itching or tickling or vibration, things that we would feel, is only about 10% of the whole pie. So does it make sense to base how healthy you are off of 10% of the picture or 100%? 100%, right? But yet most of us are basing it just off that sensory system. So one of the reasons why we do workshops is because I feel like, you know, in our mission is to change the way that people view and manage their health. So we know that if we're going to get people to change their actions and change the way that they manage their health, they got to change the way that they view their health also. So we got to do some educating, right? And what we know is our outcomes, really with anything in life, but definitely with our health, our outcomes are going to be based off of our actions, right? How, you know, our actions, whether we're working out or not, whether we're, you know, choosing something healthy to eat or not, whether we're taking our supplements or we're choosing to go to sleep and get rest versus staying up till, you know, midnight watching Netflix or whatever it is, which I'm guilty of sometimes, right? Not perfect, but you know, so our actions are based off of our decisions, what we're choosing to do, and our decisions a lot of times are based off of our beliefs, right? So or our premise, like what is this big major belief that we're you know, all our healthcare outcomes are based off of. So that's why the education piece is so important. And I think the first thing that we need to understand in our belief system is that healthy is normal, right? Like God created you to be healthy, right? He didn't create you to be damaged goods. He didn't create you to fall apart. You know, the human body's supposed to last us somewhere between 80 to 120 years. And I think that's both biblical and scientific, right? So it's supposed to last us, but why do we have so many people that it's not? When you look around, especially people that are over like 60 or 65 years old, it's hard to find people that aren't taking at least one medication, right? But again, that's not the way that we were designed. We were designed to heal, we were designed to be active, we were designed to adapt. So if we go outside and it's hot, the body will sweat. If we go outside and it's cold, the body's gonna shiver to create friction to warm us up, right? So healthy is the normal state, sickness is not normal. There's a difference between what is common and what is normal, okay? The other thing is that your body is smart. Would you agree with me on that? Yeah, it's incredibly smart. So again, think about that lady who's on the table tonight, and all the physiological functions that are going on in her body that are helping a newborn baby to develop. From 2 pinpoint size cells that come together, and then within a matter of weeks and months, you have a fully grown, complete human being. So the body is extremely smart. And you also have to understand that your nervous system, right, which is made up of your brain, your brainstem, spinal cord, and your nerves, that's the nervous system, is the master control system of the body. So it's controlling all the functions, from your heart beating to your lungs breathing to how you move, like I said, through the motor system. It's all under control of the nervous system. If you are really healthy and somebody cut your spinal cord in half, what would happen to you? Yeah, if you cut your spinal cord in half, you're done, right? It's game over. There's no power that's getting through. So even though everything was healthy, your heart was healthy, your lungs were healthy, all that kind of stuff, if there's no master system to control it all, it's not going to work, right? And then your spine. So your spine is like a pseudo armor. So when we look at the way that God made the body, the most important organs are going to be the most protected, right? So what do you think the number one most important organ in your body is? Your brain, right? And it's the most protected, right? It's completely surrounded and encased by this skull. Well, then the next thing is going to be your brainstem and your spinal cord and your nerve roots, right? So those are completely surrounded and encased by bony vertebrae. We've got 24 vertebrae in our spine that are protecting that stuff. There's 24 and they're not fused. They're all supposed to be able to bend and move and twist and turn so that we can move too. But the spine is like a pseudo armor for the spinal cord and the nerves. And the other thing that you have to understand, this is a premise, again, is that modern life is unnaturally stressful. Would you guys agree with me? Do you think life today is more stressful than it was for our parents when they were our age? Okay. Absolutely. I think I was talking to another patient about this today. I've got 3 kids, raising kids. When I was a kid, we didn't have social media and cell phones and all that kind of stuff. Now kids are constantly on those things. So kids have the whole tech neck thing going on just as much as adults. And then they've got all the social stressors that come along with it. They've got everything fighting for attention and focus, I just feel like life is so stressful now, and it's probably, would you guys agree with me? Do you think that as it gets more complicated, it's probably just going to continue to get more stressful? Yes. So it's just that much more important that we would take care of our bodies. So stress really is a huge thing. Stress is probably, if we could boil down the cause of all disease, right, to one thing, I would say it would be this, right? It's going to be stress. And when we look at stress, we can break that down into 3 categories, right? So we like to call them the 3 T's, which are thoughts, toxins, and trauma. So thoughts are like our emotional and mental stressors, right? That's like too much being in the news, right? Like seeing what's going on all over the world, and COVID and mask and going back to school and all these things, and relationships and finances and all that kind of stuff. That can be stressful for people, right? So that would be thoughts. And then we've got toxins. So toxins are more like chemical stressors to the body, right? So that can be anything from taking a prescription medication to smoking a cigarette to just the chemicals that we constantly lather ourselves in every day. So think about before, women are I think are a little worse than men because you use a lot of times a lot more products than men. But think about when you get up in the morning, you take a shower, right? The water you're showering in now has fluoride in it, has chlorine in it, has trace amounts of medications in it, and your skin is the largest organ in your body. So you will absorb. Good word. It's not the one I was going for, but I couldn't think of the one I wanted.
Drink it.
But you will absorb more toxins from probably a 10-minute hot shower than drinking a glass of water, just because your skin is absorbing a lot of that stuff, right? And then we've got the shampoo, and then we've got the conditioner, and then we've got the toothpaste and the deodorant and the perfume and the makeup or the cologne or whatever it is. There's all these if you read the label of any of those things, you're gonna see a list of words about that long that you probably can't even pronounce because it's all these long, chemical names. So these are things that people are doing every single day. And then the foods that a lot of us eat too, same thing. You read a food label, there's all types of stuff on there that you can't even decipher what it is. All these chemicals that have been added to foods for preservation or to make them taste better, all those types of things. So we all have a lot of toxic stress in our life. And then traumas is the other one, right? So traumas can actually be broken down. Traumas are like the physical stresses that we would have, right? So a lot of times when I say that, people are thinking of things like car accidents, right? Or a slip and fall on the ice, or fall down the stairs, those types of things, So when we look at traumas, this is what most people are thinking of, some type of big fall. But what I can tell you again, in like 13 years of doing this, I would say probably about 5% of our patients that we have come in because of a car accident or a slip or a fall or something like that. Most of our patients who are coming in with symptoms are not construction workers, they're not landscapers, they're not people that have physically active jobs, right? They are people who sit at a desk all day long. So this is only about 5%. So the other like 95%, those traumas are what we like to call micro traumas, right? So they're still traumas to the body, but they're happening on a smaller scale, just continuously over and over and over, right? So think of the body's resilient, right? Think of like a rubber band. If you keep stretching a rubber band, it's gonna bounce back and bounce back and bounce back. But if you keep it stretched out for a long time and it's staying there day after day after day, right? That rubber band's gonna lose its elasticity, right? So the body's the same way, like we can look down at a phone and come back up and it's fine. But if we're doing this slowly but surely day after day after day for hours, eventually again, the body's gonna lose its elasticity, it's gonna lose its ability to adapt to that type of stress. So it's not just phones, it is sitting and working at a computer. It's our sitting posture. It's how high our computer screen is that we're looking at. It's kids sitting at desk. It's reading books. It's all that kind of stuff. It's sometimes we'll see women who have children. They'll carry a baby on one hip, always on one side. Or there are people who cross their legs. They'll always cross this one and this one crosses, but this one doesn't because they never use this one, right? Or a thick wallet in the back pocket, right? The George everybody, this is where everybody pulls the wallet out of the back pocket, right? So like the George Costanza wallet, right? So that's like sitting on a wedge, on one side that's constantly putting this stress or this tilting on your pelvis on one side. Heavy purses can do the same thing, right? But this micro trauma is really where it's at. Even sleeping positions, people who sleep on their belly and their neck is constantly turned for the ability to breathe, that's gonna be a micro trauma too. So when we look at this is an interesting graphic here. The human head should weigh, somewhere between about 10 to 12 pounds. The heavier you are, the more mass you have, the heavier it's going to be, obviously. But it's supposed to be balanced, right? That's one of the things that we know is important or crucial to having a healthy spine, is having a spine that's in balance. So if we've got a head that weighs like 10 to 12 pounds and it's in balance, it's going to feel like it weighs 10 to 12 pounds. But if we start looking down at things like cell phones or laptops or iPads or whatever it is, at 15 degrees of flexion in your neck, it's gonna feel now like your 10 to 12 pound head weighs about 27 pounds, right? And we can go down the scale at 30 degrees of flexion, now it's gonna feel like it weighs about 40 pounds. If we go all the way to the far end, that's at about 60 degrees of flexion in the neck, it's gonna feel like your 10-pound head weighs about 60 pounds, right? And when we look at this poor balance or this flexion of the head, not only does it cause things like neck pain and muscle tightness and loss of motion and arthritis and that type of stuff, but it also affects your physiological functions and it affects your motor functions a lot of times too. So we know that the Journal of the American Journal of Pain Management says that your posture affects every physiological function of your body, including things like breathing, hormone production, digestion, those types of things. So do this with me. So take your head, shift it forward, and take a deep breath in. And feel that breath, okay? Now I want you to sit up nice and straight and bring your head back, balanced over your shoulders, and now take a deep breath in. Feel the difference, right? Now shift your head forward again, and try to raise your arm up as high as you can in front of you, okay? Now shift your head back again, and now try to raise your arm up as high as you can. You see the difference?
Yeah.
All just from the posture of your head. So it's definitely affecting your body in a lot of ways. So when we have vertebra, or we've got one or more spinal bones in our neck that starts to shift out of alignment, especially if it goes into flexion, that's what we call subluxation. So subluxation is this misalignment, and when we have subluxation, along with that comes things like not just the joint misalignment, but soft tissue damage. So if we have subluxation for too long, and let's say the spine is curved to the side like this, and we've got a head tilt, it's gonna start to stretch the tissues on this side, and the tissues on this side are gonna start to become tight and immobile, like they're not gonna move very much. So we'll have damage to the soft tissues. It can cause inflammation in a nerve, right? So if we have a bend in the spine here, and there's nerves that are coming out of the spine going down the arm, and it's always like this, it's gonna close down the little holes in the spine where the nerves come out. So if those holes start to close and we end up getting pressure or squeezing or irritation on that nerve, the signals flowing through there can't flow through as well. And then again, first we might have signs, then we might have symptoms, and then we're gonna have some type of condition or some type of disability. And then the body, it's smart, right? We already said that the body's smart. So when we have an injury, what's it gonna do? It's gonna try to protect that injury, right? And one of the ways that it does that is it's gonna make your muscles spasm up and tighten around that injury, just like a brace. Like if we put a brace on our back or a brace on our neck after a whiplash to help protect it so it doesn't move, the muscles will do the same thing, but then the muscles get all tight and spasmed, and that doesn't feel good. Immobilization is we've got these discs that are these little spacers between the bones, and when we're fully grown, we don't have nerve supply going into, or we don't have blood supply going into those discs carrying oxygen and blood and that type of stuff. So the way that these discs get nutrition and fluid and oxygen and blood is through movement. So when I bend my head this way, this side stretches, it creates a negative pressure pulling fluids in. When I bend this way, same thing on here. When I go back, same thing to the front, and when I go forward, same thing to the back. So that's what we call immobilization. And when we're able to flex and extend and bend to the other side and twist and turn, that's gonna pull nutrients into those discs and help keep those discs healthy and prevent them from breaking down. And then joint fixation is another one. So again, that's gonna cause things like stiffness and stuff. You know, if you thread a nut on a bolt, but you don't have it lined up properly, it's not gonna move right. Same thing with your joints. You know, if they're misaligned, they're not gonna move properly. And this is a big one too, is that it's gonna cause elevated stress hormones in the body, right? So the nervous system, again, is in control of every other system of the body, including the endocrine system, which affects how hormones are produced and released in the body. So stress, like we said before, is the cause of a lot of diseases, but do you think stress could ever be a good thing?
Yeah.
Yes.
Yeah, in small doses, right? So like, this would be a stress if I'm lifting weights, right? That's stressing my muscle. But what happens if I'm doing it healthy and I'm not lifting, you know, way too much with a really bad form and all that kind of stuff? The muscle's gonna get stronger and it's gonna grow, right? So stress can be a good thing too. But the thing is that the stress response is good for like acute things, right? Things in the short term a lot of times. So the stress response is kind of nicknamed the fight or flight response, or the fight or flight system. Have you guys ever heard that? Mm-hmm. And what that means, if we're stressed, if we're out camping and a bear or a coyote or something comes to our website, comes to our campsite, could come to your website, I guess, right? If a bear comes to your campsite, would anybody besides me get stressed if that happened?
No.
Yeah, I might be a little stressed, right? Or if you're out hiking on a trail and there's a rattlesnake in front of you, like that might create a little bit of stress, right? So here's the thing, is that fight or flight means that you're either gonna fight the threat, right, and defeat it, or you're gonna flight, which means you're gonna run in the opposite direction as fast as you can to escape the threat. It's all about survival and protection of the body, which is a good thing, right? We want the body to be able to do that. But for the body to be able to effectively do that, things are gonna change, right, physiologically. So blood pressure is gonna go up, right? Because we want blood pumping to all the places it needs to go so that we can fight or flight, right? Heart rate is gonna go up, again, so that we can pump blood to all the muscles so that we can fight or flight. Muscle tone is gonna go up, right? So muscles are gonna get tighter, right? So that's good in a short term. Things like reproduction, is that gonna go up or down, do you think? How important is it for reproduction if you're running away from a bear or rattlesnake?
0.
It's not important at all, right? So the body is what, smart or stupid? Smart. So what's it gonna do to all the focus for reproduction? Yeah, exactly. How important do you think it is to digest your food if you're fighting a bear? Not very much, right? In fact, sometimes what will happen, people will get so scared that you will, yeah, Kelly said poop yourself, right?
Undigest. Yeah.
Or pee your pants, you're so scared. You've heard that happening to kids, right? Because again, the body, if it's worried about surviving in the next 5 minutes, it doesn't need to worry about that. What about fighting a cold or the flu? You know, how important is that if your body's worried about if it's gonna survive in the next 5 minutes? Not very important, right? So guess what happens to your immune system when the stress response kicks in? Drops down, right? The sensory system's gonna go up, right? Pupils will dilate. So if that bear comes to your campsite at night, your pupils are gonna dilate so that you can take in more light, so that you can see more, so that you can fight or flight again, right? But again, if we're walking around with our pupils dilated all day, we're getting too much light and too much information into the eye, guess what that's gonna do to your head? You're gonna probably get a headache, right? Fear and anxiety are gonna go up. Insulin sensitivity is gonna go down. Blood sugar is gonna go up. Why would blood sugar go up if you're in fight or flight mode?
Heart beating quicker, or
Yeah, what are we gonna use that sugar for? We're gonna use it for some energy, right? So it's gonna start mobilizing sugar, put it into the bloodstream. It actually decreases the good cholesterol, increases the bad cholesterol. Clotting factors, like for blood clots, why would that be important in a fight or flight situation? Yeah, what if the bear claws you, right? Your body's smart, it knows that it wants to clot. So all of those things are good if we're fighting a bear running away from a rattlesnake. How good are these things if it happens to us day after day after day because of what we see on the news, or we're stressed about our relationship or our job or something like that? Are any of these things good in the long term? No. What do they lead to? They lead to more disease, right? So this is what we call adaptive physiology. The body's adapting to stresses. We want to make sure that it's adapting properly. So this is an interesting one I wanted to put in here. This is Alejandra. So she's been a patient of ours for, gosh, I don't know how many years, maybe 5 years, something like that. It's been a little while. So she lives in Granite City, Illinois, which is what, like 45 minutes away, something like that, 45 minutes to an hour away. When she speaks pretty good English now, but when she first came in, she's from Mexico. She didn't speak good English at all, and in fact, she had to bring somebody in with her to interpret our consultation and conversations with her. So she was kind of in a desperate need, and what happened is that for, I don't know, I want to say it was maybe like 5 years, she had this condition called cyclical vomiting syndrome. And essentially what happened is a patient of mine who was a great patient and came to workshops and knew all about the nervous system and all this stuff I'm telling you about, knew that the whole body's under control of the nervous system, right? And this friend of hers was Alejandra's mom or aunt, something like that. And the mom or aunt was telling my patient about Alejandra. And they said she's been diagnosed with cyclical vomiting syndrome. They said they don't know what causes it, but they know that it's a nervous system disorder, right? So my patient, the light bulb goes off and she said, oh, well, if that's the nervous system, you need to go see my chiropractor. So she comes in from Granite City, she brings somebody to interpret the conversation with her. And for a number of years, she would get these kind of waves or episodes where she would start to get nauseous, and then she would get sick, and then she would start throwing up, and she would throw up for weeks and weeks on end. And she would get all dehydrated, and she'd have to go into the hospital. They didn't know what caused it, right? So they didn't know how to treat it. So they'd give her pain medication, they'd give her anti-nausea medications, and they would give her fluids. And she'd be in the hospital for sometimes about 2 weeks, right? And then it would get a little better, and then she'd go back home, and then sure enough, 3, 4, 5 weeks later, it would come again, and then again, back in the hospital for 2 weeks, getting all these meds and just resting and stuff. So this would happen over and over and over again over about 5 years. And she got down to a weight of about 80 pounds. She couldn't eat stuff because it would make her sick. Young, pretty girl, didn't have a boyfriend, didn't have any relationships, didn't have any fun, recreational activities, that kind of stuff. Couldn't hold down a job, right? Because she's every month she's missing 2 weeks of work because she's in the hospital. It got to the point where she was so sick and so weak that she couldn't even bathe herself. So as a 20-something-year-old woman, her mom's helping her bathe because she's so weak. And this is going on for years. And the medical doctors didn't have anything to offer her except anti-nausea medication, pain medication, and fluids, right? So she comes into the office, and I said, I don't know if we can help you or not. I said, but we'll check your spine. We'll see if you have subluxation, if that's affecting your nervous system. And if so, then you're in the right place and maybe we can help you. Since the first day that she came into my office, she's not been back to the hospital once. And that's been like over 5 years. So this whole condition that she had is completely gone, right? But a lot of times people think chiropractic is only about neck pain or back pain, but again, the nervous system controls everything in the body, right?
Mm-hmm.
So one of the other things is that I said subluxation can create nerve irritation, right? So if we look at like nerve irritation, we've got the brain, we've got the spinal cord that sits inside the spine, and then in between every vertebra there's these nerves that come out, right? And this nervous system is controlling everything. So the way your heart beats, the way that your lungs breathe, the way you digest your food, your reproductive organs that are down here. I'm noticing my whole screen's not showing up on here. Some of it's cut off. How you digest your food, everything is under control of the nervous system, right? So if I took a pair of scissors and I cut these nerves that are going to the stomach in half, what's gonna happen to the stomach? It's not going to function, right? It's going to shut down, right? It's like if I have a computer and I cut the power cord to it, right? What's going to happen to the screen? It's going to turn off, right? There's no power that's getting through. So if I have subluxation, and because of whether it's macro trauma or micro trauma or some other type of stress, and those vertebrae start to shift and bend, and now that bend is putting pressure or irritation on that nerve, it's not like the organ shuts down, but it's like turning down the dimmer switch on a light, right? There's still some power that's flowing through, but it's not full power, right? So if we don't have full power, then the muscles and the organs, they can't adapt as well, right? They can't heal as well. The person can't function as well, right? And a perfect example of this, you guys, I think maybe everybody will know who Christopher Reeves is. You remember Christopher Reeves, the guy the actor who played Superman back in the 80s or whatever it was? So he fell off a horse, right? And he fractured this very top bone in his neck. And a fragment of that fractured bone cut like just a couple millimeters into the backside of his spinal cord. But that was where the nerve tracts were running down that were controlling motor function to his arms and his legs. And as soon as that injury happened to his neck, nothing happened to his arms or his legs, but to his neck, arms and legs all of a sudden boom, shut down, didn't work, right? And eventually he died because of all the other functions that were affected, all from an injury to his neck, right? So, you can kind of see here, the neck, like I said, should have this curve to it that goes from back to front. And in between the vertebra, there are these discs, and the discs are like little spacers, right? And they create room for the nerves to come out of the spine and go to all the muscles and organs. So if we start to lose that curve in the neck and the weight of the head, remember how I said as it goes forward, how much more weight and pressure it creates? The weight of the head on these discs can cause the disc to bulge or herniate, okay? So a disc, think of it like a jelly donut. The outside portion, the donut portion is like made of cartilage, like these rings of cartilage, but the inside is called the nucleus propulsus, and it's made up of this gel-like substance. So if you take a jelly donut and you squeeze it too much on one side, what's gonna happen to the jelly? It's gonna squirt out the other end, right? So if we put too much pressure on the front of the neck and it puts pressure on that disc, it can cause that disc to bulge and just hit that nerve, right? And nerves are very, very sensitive structures, so it doesn't take a lot of pressure on that nerve to send lightning down your arm or numbness or tingling or weakness or whatever it may be. But also remember, those same nerves that are going down the arms are going to heart, they're going to lungs, they're going to thyroid, they're going to all that kind of stuff, right? So, again, it doesn't make sense to base everything off of just how we feel, because that's only a small part of the system. I do want you to see this too. So you guys see this blue nerve that comes from up here, and how there's branches of it that goes all over. So remember, that every signal that's going from your brain to the rest of your body has to pass through this top area first, right? So it's the most important area, this very top vertebra, that's called C1 or Atlas. Atlas in Greek mythology is the guy that holds the world on his shoulders, So this bone, Atlas, holds the skull and the brain and all that stuff on his shoulders, basically. There's a nerve that comes off of here at C1 called the vagus nerve, right? And the vagus in Latin means wandering, so it wanders all over the body. So issues like this, like what happened to Christopher Reeves, right, can affect all of these organs, right? So neck pain is not just about the neck, it's about the heart, it's about the lungs, it's about the stomach, it's about the digestive system, reproductive system. All of that is all being controlled by some portion of that very top bone there in the neck. So again, you know, we can see when we hit this forward flexion, 45 degrees, we've got about 49 pounds of pressure, but the head only weighs like 10 to 12 pounds, right? And at 60, you've got 60 pounds. At 75 degrees of flexion, like this guy, you've got 70 pounds of pressure, and then we don't want to be this guy right here. But here's the thing, if you take this 10-pound ball, right, 10 pounds, about what your head weighs, and I put a curve in my wrist, like that curve is supposed to be in my neck, and I can rest my elbow on a desk or something like that, it's not too hard for me to hold that weight and balance it there, right? But when I start to go like this, all of a sudden all my muscles just contracted here. When I go like this, now that 10 pounds is feeling like a lot more than 10 pounds. And if I go like this, pretty soon my arm's gonna be shaking, right? Anybody wanna try that? Or you take my word for it.
Yeah.
Here, feel so 10 pounds, right? That's what your head weighs. Right?
So do a lot of restaurant servers have issues in it? 'Cause that's what I always get amazed.
How they do that.
Oh my
But
God.
again, yeah, they're like this and they can balance that weight,
Yeah.
right? So when we've got, you know, the proper curve and the balance in there, it's not too hard to hold like that. So these are the problems, okay? How about some answers?
Good.
Anybody want some solutions here? Okay. So we use this term that we call the three-legged stool, and the three-legged stool is the key to results, right? And there's the three pieces. We need all three legs, right? Because if this stool only has two legs, we're not going to be able to balance. It's not going to be able to hold stuff up. So we want all three legs. So the first leg is going to be breaking bad habits, right? So if people are coming in as patients and they've got issues with their neck because of looking at the phone or their sleeping position or, you know, sitting at the desk with the computer too low, whatever it is, and I'm constantly, you know, 3 times a week working on them to try to get them better, but they keep 7 days a week doing these bad habits, is that going to slow us down or speed us up with our results? It's going to slow us down, right? So if we can break those bad habits, that's going to speed up our results, right? It's going to get us better results faster. That's our new patient workshop that we talk about. So breaking bad habits is huge. That's number 1. Number 2 is going to be adding some specific exercises. So with the technique that we do in the office called chiropractic biophysics, it is a structural correction technique. So we don't want to just make, you know, things a little bit better. We want to try to correct the spine like braces would correct teeth, right? So if somebody's got a flexion like this, I don't just want them doing an exercise to here and back, because, you know, then maybe they'll end somewhere halfway in between. If they're like this, I want them doing an exercise all the way over here, right? To bend all the way to the other side so that we can end up at neutral. Does that make sense? So mirror image exercises. The thing is too, is that exercises and rehab is not just the stretches or the exercises, but it's also something that we call traction. So chiropractic adjustments are gonna work with the bones and the joints. Exercises and stretches are gonna work with what? What kind of tissue do exercises work with? Muscle, right? But we also have something called tendons and ligaments, right? So tendons are gonna attach muscles into bone. Ligaments are gonna attach bone to bone. So we also need to make sure that we are able to like reshape or change tendons that have altered shape due to repetitive, you know, bad habits or whatever type of trauma that's caused them to be that way. So that's what we call traction. And we've got some traction devices we do in the office, but we also have traction devices that we give for people to do at home, like the Dental, right? So you know what that is. So all 3 of these are important, and then the third one is that the chiropractic adjustments, right? So adjustments, a lot of times people have this notion that like, I've got this bone out of place, I'm gonna go to the chiropractor, he's gonna adjust it and push it back into place, and then it's gonna be fixed, right? It's not really the way that it happens. So more of the way that it happens is, imagine like a bucket, right? If you have a bucket, you put it under the faucet, we barely turn that faucet on and the faucet's dripping, right? Each drip is like an adjustment. Eventually it's gonna fix the problem, right? But problems that have been building for 5, 10, 15 years or more, they're not fixed with one adjustment, right? It takes time. It's like a lifestyle, right? It's like if your teeth are in really bad shape, you can't just brush them really good once. Like you got to keep on brushing them, right? So each adjustment in rhythm is going to move you closer and closer to your goal. So bad habits, right? That was number one. So when we talk about tech neck, right? So we want to make sure from bad habits, if we're holding the cell phone down here, like this, that's bad for this curve in our neck. So we want to make sure that we're holding it up in front of our face and having our head balanced. If we're working on laptops or desktops that are too low, we want to make sure that we're raising them up to eye level so that we can sit in a good posture at our desk. If it's a laptop, that also means, unfortunately, that your keyboard goes up, which this is not good. So if it's a laptop, you might want to get an external monitor or an external keyboard so you can still be in a healthy position with your hands. So those are some examples, and we go over many examples at our new patient workshop, which I know some of you guys have been to and some of you haven't. So that's breaking bad habits, right? The other is going to be exercises. So this is a really great one. It's YWLT. So think of you will love these exercises, okay? So life extension exercise. So remember, we're supposed to have extension or a curve that goes from back to front in our neck, but too many people have flexion, right? So we want to get the spine more into extension. So what we want to do is we want to take our thumbs like this, point them behind us, put our hands into a Y shape, and then extend back, squeeze those shoulder blades together, and bring the head back, and hold that for 20 seconds. Okay? So that's one. That's your Y. Then what we want to do is take the thumbs pointing back, and we want to make a W. Same thing, we want to pull the shoulder blades back and together, down towards our feet, and bring the head back. And you can feel all those muscles tightening up, right? Because those muscles a lot of times are weak because we're tuning, we're in flexion too much. So that's the Y, or the W. And then the L, right? So the L, we're going to take our hands like this, and we're going to take those thumbs and point them again backwards. Kind of pin your elbows in to your ribs there. Squeeze again those shoulder blades together. Push them down towards your feet and bring your head back. Okay, so that's your L. And then the last one is the T. Same kind of thing. Thumbs backwards. We're going to bring our arms up like a cross. We're going to squeeze backwards, shoulder blades down, and pull the head back. So we want to hold those for 20 seconds. And we want to do one round of those for every instance of 2 hours that we're sitting. Okay, so it's going to take you, 4 exercises for 20 seconds. It'll take you about a minute and a half, right? It's not going to take a whole lot. But we want to make sure that we're doing that at least once every 2 hours that we're sitting.
Can I take a picture of that?
Sure. There you go.
I can email this to you too, Diane.
Oh, that'd be great.
Yeah.
Thank you.
Okay, so another one
Nice and done.
that I want to go over. Who's seen one of these?
Oh, yeah.
The prolordotic is what this is called. So lordotic for lordosis in the neck is that curve that goes from back to front. So one of the main exercises that we do with this is an excellent exercise for your neck. One of the main ones that we do is we push straight out, we bring the hands together like this, and we relax the arms, and when we push out, we go into extension, pulling curve back into the neck from the back to the front. We relax, and then we do it again. So this is kind of the general one that we give most patients who have straightening of the curve in their neck, okay? There's a couple, if you have one of these, there's a couple other things that you can do to help increase more range of motion in your neck. So I want you to think of just saying yes, okay? So I want you to pull this out, and you're just gonna nod your head, yes, like this, right? You can do like 5 to 10 of those, and then relax, okay? Then you can take the same band, you can push out, and then you're gonna say no. So you're just gonna shake your head left and right, go back 5 to 10 repetitions, and relax, that's your no. Then I want you to say maybe, or I don't know, okay? So you're gonna pull out again, you're gonna be like, I don't know, you know? And you're just gonna move your head back and forth from left to right like that. So we're gonna move the neck in all these ranges of motion. And then the last one is like a turtle, okay? So what happens is when the head goes forward like this and the neck starts to curve, The brain knows we shouldn't be walking around like this because we might walk into somebody, right? So
Right.
it's going to take these muscles right up here at the back of the skull, and it's going to shorten them, and it's going to pull our head like this, level with the horizon. So we see people walking around like this all the time, right? So what we want to do is we want to strengthen these muscles that get weak and stretch these ones back here that are pulling us into extension at the top of the neck. So we'll take this again. We're going to pull out to the side, bring it forward, and then we're just going to tuck our head back like a turtle into the shell. Like that. Make that pretty double chin, right? Pull back. And then we'll do about 5 to 10 of those. So those are the 4 kind of new things that you can do with this that will help to increase your results. And then we've got the dental roll, right? So if you haven't seen the dental roll, Steve, yet they look like this. They have a very specific shape to them. And what it does is 2 things. So it is going to, when you lay on your back on this orthotic, your head's gonna fall back over it. So when people have too much forward head translation, it's gonna work to bring your head back into balance as it falls back, while it's holding a curve in your neck. So this is the same person, right? This is where they're laying on their back. This is the back of their head. This is their shoulders down here, and here's their neck. So this is how they are without the dental roll. You can see how straight that neck is. This is while they're on the dental roll, okay? And it's really important, there are some contraindications for this. So we don't wanna just blanket, everybody gets a dental roll. So you can't go and buy one off Amazon or something like that, because somebody could potentially buy it that has a contraindication and it can harm them, right? So we gotta make sure that you're fit for the right one, that you're a good candidate for it, and there's 3 different sizes, right? So those all have a specific function too. The gold one is for kids, the medium one is for shorter people who have shorter spines, and then the large one is for taller people that have longer spines. The problem is if we get a too large of one too, it may push the head more forward and negate the purpose that it's meant for. So this is an interesting study. You can see this is a female over here in her 50s. She's got neck pain, headaches, dizziness. This is before and after, just with using her dental roll, not even chiropractic adjustments, just the dental roll alone. See, this red line is where her neck is and the green line is where it should be. That's where it was after 10 weeks of therapy on the dental roll. So huge changes. There's another before and after down here that you can see. This one is actually after 1 session. So this was on a chiropractor actually. And they laid on that dental roll for 15 minutes. They took it out, they waited 5 minutes, and then they took a follow-up x-ray, and that's how it was. So we'll get changes right away, right? But again, the body is elastic, right? And muscles have memory, so we can stretch it out, but it wants to bounce back. So that's why we have to keep doing these kinds of things repetitively. And then this is kind of a newer thing. This is, people ask me all the time about pillows and like, what kind of pillow should I sleep on? So this is what we call the dental roll pillow, and it's pretty interesting. My wife and I both use one of these at home. So it has, actually, that shape is the same shape as the dental roll. There's a little video here, it's just a couple seconds.
Allows your head to recline all the way back to the mattress when the pillow is oriented vertically. Click here to purchase your dental roll pillow.
So you guys can kind of see from the video how that works. It's a great pillow for both back sleeping and side sleeping. What I like about it for side sleeping is you'll notice it has a different height here than it does here than it does here. So 4 different heights on 4 different sides. So you just change the orientation of the pillow for what fits you best. But with that dental roll shaped cushion in here, this middle piece flips all the way out. So when you're laying on it on your back, your head falls into that hole and it's on the same plane as your back. So it reduces your forward head translation and supports your curve all at the same time. And then they put a lot of research into the foam that they use. You can kind of see, can you guys kind of see how there's like ridges in here? They put ridges in there for airflow, because a lot of times people complain with like foam mattresses and pillows and stuff that they're hot. So like this thing doesn't sleep hot because it's got all that kind of stuff. So very, very cool thing. If anybody wants one or needs one, I think we've got to see one. Did we just have one of them right now?
It's on sale this month.
Yeah, they're on sale this month. We're just gonna end it in a week or so here. They're 20% off. I want to say they're around 120 bucks or something.
129, yeah.
So if you want one and we only have one, just let Kelly know, and we'll get you one ordered and we'll give you the sale price for that. And again, you know, so we've got the bad habits, we've got the exercises, and then we've got the chiropractic adjustments. So here's the thing, how do you know if you need a chiropractic adjustment? That would be a good question, right? Because again, can you feel it if you have subluxation?
No.
Not necessarily, just like you can't feel a cavity in the tooth or a blocked artery. So if you can't feel it, how would you know if you need it or not?
Your wife tells you.
that's the truth for a lot of men in my office. That's funny. Yeah, your wife tells you you need to get checked. Here's the thing, you know, anything that's of value to you is worth taking care of. Yes or yes? Yeah, absolutely, right? So like, if you have a car, you're gonna make sure that you get your oil changed, right? Your tires rotated, because it's expensive and it's a hassle if your engine blows up or if you have to go buy new tires, right? So we wanna take care of it. Your teeth are important to you. You know, people appreciate their appearance and stuff. So you gotta brush your teeth. We all know that we have to go get dental checkups, you know, once or twice a year and make sure that they're healthy and get everything all cleaned up and pretty again. So we just gotta take care and maintain the things that are important. How many people do you think maintain the health and integrity of their spine?
Chiropractors.
Yeah, about 14% of the population. That's not very much, is it? So only about 14%. And here's the thing, if your car blows up, can you get another one? If your teeth fall out, can you get dentures? If your spine rots and falls apart, can you get a new one?
Nope.
No, right? So, and again, it's protecting the most important system of your body. So when people, you know, come in to get checked, there's some ways that we can find out if you can benefit from this or not. And most people can benefit. But there's kind of 5 objective criteria that we look at. So one is gonna be posture and balance. Like if I saw this young kid coming in today, really, he tweaked his ankle in soccer practice. He had a little bit of a hamstring pull. Outside of that, his parents were just bringing him in because they wanted him to be healthy and well, right? So no big symptoms or health conditions. But I noticed when I was looking at his posture, he had this forward shift here, backward shift here, head was like this, and his head was tilted some. So I had him move around, shake it all out, and stand again. And then I took a picture of him, still there, right? So I told his dad, I said, well, you should take some x-rays because he's got some things off, right? So one is gonna be posture and balance. X-rays are going to be super important. You know, that's going to be probably the most objective criteria that we can have. If we can see curves or bends that are in the spine that shouldn't be there, and we can measure them and we know exactly where they are, we have a good chance at correcting or improving a lot of those. If we can't see, we don't have X-rays, and we go into the chiropractor, and there's some places, you know, around town, I'm not gonna name them all, I'm sure you've seen some of them. Some of them look like Massage Envy of chiropractic. You can go in and pay $29 and you say, doc, it hurts right here, and they crack you, and then they send you out the door, right? If they can't see it, what if there's a tumor in there? You know, what if that's what's causing the pain? You know, I've had a patient that had an abdominal aortic aneurysm. You know what that is? So like this big old bulge, weakness, and like the largest blood vessel in the artery here. If I would have laid that guy on his belly and jumped on him, or you know, put him in side posture or something like that and twisted him, and that thing would have ruptured, he would have died. You know, so making sure that you have the right test, super important. Range of motion testing. If we see that you can turn your head all the way this way, but you can only go to here on the other side, there's obviously something wrong there. Orthopedic testing are gonna let us know a lot of times, like, hey, is this a muscle issue? Is this a joint issue? Is this a ligament issue? And then palpation, static and motion. So we're gonna statically feel along your spine. Does anything feel like it's shifted or out of alignment? Then we're gonna move it. We're gonna kind of push on it, see if it's springy and spongy feeling. So this whole thing, this whole test, with the consultation where we go over your goals and your objectives and all that kind of stuff, in our office costs $200. One of the things that we do for anytime we have a workshop, we always offer it for $47. So anybody who, you guys have all been checked, but if you have family members, you have friends, co-workers, anybody like that, and they're complaining about neck pain or headaches or pain in their arm or whatever, and you want to get them checked, we will kind of pass on the gift through you to them. So all you have to do is talk to Kelly, let her know if you've got a family member, a friend, neighbor, coworker, whatever it is that you would like to get set up and get checked. You guys can tell them about it, we can follow up with them, and we would do that for $47 for them instead of $200. When do you think would be a good time to get your spine checked to see if it's healthy or not?
Can you say that again? What was
Like
it?
let me rephrase it. Like at what age do you think would be important to get your spine checked, see if it's healthy?
Early.
40.
As soon as you come out.
As soon as you,
I like Kelly's answer. Not bad. Not bad, but better than 70,
that's
right?
a guy answer.
Better than 70, right?
Yeah.
So why would it maybe be important for as soon as you come out? Why might it be important for a baby to get their spine
The
checked?
trauma of
Birth,
childbirth.
right? That's a
Yeah.
good point.
Yeah.
Exactly. Yeah. So
Yeah.
I have some. I almost pulled them. I should have pulled them out. I have some obstetric forceps in the back, and I have this little baby doll that we sometimes use as a demonstration. But if you've seen a baby before,
Oh,
it is
intense.
crazy.
Yeah.
So like all three of my kids were born C-section, not by choice, but just thank God we had that option when we needed it.
Mhm.
But whether it's by C-section or it's vaginal birth, the first thing that comes out is the head, right? And if you see it, they grab that baby's head and they're pulling and twisting and turning and yanking the shoulders out. Those little bones aren't even formed yet, right? So it's easy for something like that to get misaligned, right? And a lot of times in babies, they can't tell us if they have pain or not. But again, how important is that? Because even as a fully grown adult, you might not feel that you have it, right? But a lot of times what we'll see is we'll see things like ear infections, we'll see colic, we'll see digestive issues, constipation, that type of stuff. Kids that won't go to sleep, or they'll only latch on one breast but not the other because it hurts their neck or their neck can't go to the other side. So these are all things that we see even with babies that are getting better, through chiropractic adjustments. And then when the spine is still growing, like we've gotten into this like scoliosis care. So when the spine is still growing, that is when we've got the largest risk of things like scoliosis and curves and things like that progressing or getting worse. So we want to fix it while the spine's still flexible and young. It's a lot easier to grow healthy kids than it is to fix sick and messed up adults.
Right.
So that's why people get their kids checked. That's why you guys will see babies sometimes. And then kind of last thing here is just, I always like to say the 5 most dangerous words when it comes to your health are maybe it will go away, right? And maybe it won't. So again, if you've got signals, you've got symptoms going on, remember that the body is talking to you, is talking to you for a purpose. So you want to make sure you get it checked out and give it what it needs. So that's all I got for you guys tonight. Any big questions for me?
I have one.
Yes.
So I've been told that fascia is a big deal when you get older because it hardens or something. So I'm thinking that could be what's wrong with my neck is, the fascia is
Yeah.
there and not stretching out very well anymore. So is there anything other than the exercises? Is that about it?
Yeah, so there's, like myofascial release and massage or like soft tissue techniques. And I fully support that. I've got a stack of business cards in here for my massage therapist that I give to patients all the time. We just wrote a script for a patient to go get physical therapy the other day. We're not, the end all be all, like we can't fix it all. When we look at like alignment of the spine and subluxation, that kind of stuff, first off, chiropractors are the only healthcare providers that are trained to both detect and treat subluxation. But you don't just have the bones, you've got muscles, you've got ligaments, you've got fascia, you've got other soft tissues, things like that too. So yeah, there's other techniques like myofascial release. Sometimes we give patients like foam rolling exercises that they do, that type of stuff that can definitely be helpful. When we look at things like scoliosis, and I'll use that as an example because that's kind of the extreme, right? So when we look at extreme things like that, we look at the research, when we look at chiropractic adjustments alone, they don't stop or reverse scoliosis. When we look at physical therapy alone, it doesn't stop or reverse scoliosis, right? So it has to be, we need traction to be able to, again, treat those soft tissues like ligaments, that need to be reformed. There are exercises that need to be done, and then there's adjustments, and those adjustments need to be in rhythm. But sure, yeah, we can get fascia that can get little kinks and, adhesions and stuff like that in it. And definitely if that's the case, then getting some myofascial work can definitely help with that.
So that would be a massage therapist?
There's some massage therapists that have kind of specialize in it and stuff. Sometimes they'll use tools that kind of scrape you. I'm sure you've seen, people like CrossFitters and stuff a lot of times will use tools to scrape.
Yeah.
like the Theragun kind of thing. You know, sometimes people will call that like a fascia blaster type of thing. Cupping is a technique that some massage therapists will do where it draws blood into the area and brings oxygen, and then they can move it around, and sometimes that can help with the fascia too.
So I got a card from you from one of those,
Yeah,
so I should call her.
yeah, she's great. I think you'll like her a lot.
Thank you.
Yep, you're welcome. All right, well, that's it for tonight, guys.